Welcome, everybody, to the Texas Primary Care Consortium's Monthly Monday. My name is Nishi Singhal. I'm the program officer with the consortium. The consortium's Monthly Monday Primary Care Talks, we are dedicated to interviewing guest speakers from across Texas, covering a wide range of primary care topics. Each month, we are bringing you informative episodes as your go-to resource on all things primary care. Today, we have a very special guest. Her name is Lisa Kirsch. Lisa Kirsch is a senior policy director at the Dell Medical School. She conducts health policy research and analysis to support innovations in healthcare delivery and payment. She holds a master's of public affairs from the LBJ School of Public Affairs. Prior to joining Dell Med, Kirsch worked for more than 13 years at the Texas Health and Human Services Commission on Medicaid and Children's Health Insurance Program policy issues. She served as a chief deputy Medicaid and CHIP director, where she oversaw the policy department and the development and implementation of more than $10 billion in delivery system reform incentive payment program under Texas's 1115 Health Care Transformation Waiver. There's just so much that Lisa has done. Prior to joining HHSC, Lisa also worked for the Texas Home Health and Community Care Services Provider and the Arizona Joint Legislative Budget Committee. And so this episode was really great, where you will actually learn more about our payment system. And Lisa really is an expert on this, on changing the payment system in primary care and how that connects to expanding the primary care workforce. Let's go to the show.
Thank you, Lisa, so much for joining us today. I would love to know a little bit more about you and how your work impacts our primary care system here in Texas.
Sure, and thank you for having me, Nishi. I am fortunate. I'm the policy director at the Dell Medical School at UT Austin, and have a number of projects that I'm working on that do relate to improving primary care in the state. My background is in Texas Medicaid. I worked for Texas Medicaid for about 13 years before I came to Dell Med in 2016. And so, I've seen firsthand, right, how coverage and how having primary care access improves lives and improves health. And so that's something that I'm passionate about. In my current job, I have a number of things I'm working on that relate to this. I do support the Texas Health Improvement Network, which is administered at UT System by Dr. David Lakey and his team. And that's a consortium of folks that multidisciplinary that makes recommendations around policy in the state. So we're looking at workforce now, and one of the areas we're focusing on is primary care. I also have some funds from the Episcopal Health Foundation and serve on HHSC's value-based payment improvement. I'm missing a letter there. Advisory Committee, Quality Improvement Advisory Committee. And so we make a lot of recommendations in this space as well. And then last but not least, I currently have a HRSA demonstration award for 5 years, where I'm partnering with the Dell Children's Comprehensive Care Clinic in Austin. And they are a model of excellent patient-centered, family-centered primary care. And so that demonstration, we are looking at how to advance care integration and payment reform and policy reform that will allow them to provide even better care to the families that they serve. So I have a lot of interesting work that I get to do in my job.
That's why I feel like we're so lucky that we have you as a guest, because you can speak on so much within primary care. And so related to that, I would love to hear in your words, how would you define primary care?
So, I mean, to me, primary care is having a place, having a health home that helps you to manage your care, right? At the most basic level. So preventive, getting your immunizations, getting your annual well checks, but also equally important, managing any chronic issues that you have, right? So I just think of primary care as essential to keeping our population healthy. And then if we're not as healthy as we want to be, helping to just help people to be as healthy as possible, given the conditions that they may have. So I also very much think of primary care as a team-based sport. So of course you have your physicians and your advanced practice providers, nurses, ideally also mental health support and other supports as well that help people to, in all the aspects of their lives, right, to be as healthy as they can be.
And within all the work that you had shared that you are working on in primary care, what do you feel like is one primary care challenge that you are currently alleviating? And maybe there are actually multiple challenges that you're working on through all the different projects. What do you really feel like is that one thing that once we can overcome that barrier, once we can solve that challenge, it would, of course, expand our primary care system?
So I think both for my HRSA project for children with medical complexity and with the workforce project that I'm doing with the Texas Health Improvement Network, a lot of this comes down to how we pay for care. And to me, that's a huge challenge, because if you're paying on, an E&M code for a visit, and you have to see a doctor as opposed to maybe another kind of professional who could also help address needs in many cases, our system just we don't pay enough for primary care services. And we see that, right? If you look at where physicians are choosing to practice coming out of med school, they have a lot of debt sometimes. It's maybe daunting to think about doing primary care, even if you want to, because you're worried that you're not going to earn enough doing that to pay off your student loans, right? So that's something that we need to think about. To me, we need primary care providers. We need doctors and others as well. And so I want there to be enough primary care workforce for all Texans, right? And the incentives are not necessarily there financially. I will also say with my HRSA project, and we see this, right, that they're trying to integrate care. They're trying to coordinate closely with specialists, with the hospital as children are coming out of the hospital, with home health agencies. And the way that care is typically paid for is you get a payment for a visit, the specialist gets a payment for a visit, the home health agency has to do their assessments and visits. But we're really trying the clinic I work with is trying as hard as they can to really quarterback and provide integrated care. And so we're trying to work with our partners at Medicaid and their health plans to say, can you pay differently? So for example, if you could pay a per member per month for the care coordination services that they're providing, for integrated care planning, where that they can have everybody kind of on the same page about this very high need child's care. That's so much better for the family than having to do that assessment like 6 different times, and answer the same question 6 different times and not have everybody be on the same page. So I do think that payment and policy reform is going to be key to strengthening our primary care system in the US.
I love that. And I love asking this last question, but I have a feeling I might know your answer. And the question is, if you had a magic wand, what is one thing you would change about the primary care system? My gut feeling is that you might talk about the payment system. And so if you do, if you could really also, make the connection on why is that so crucial? Why is that so crucial to really lead to that high quality primary care?
Sure. So a couple things. I mean, we know from the work I'm doing with the Texas Health Improvement Network and from the data we get from the Department of State Health Services and also federal data, right? We have a shortage in our primary care workforce in Texas. And if you look out 10 years, we're a growing state, we're an aging population, our needs are not getting smaller, right? And so we project that our shortage is not gonna shrink either on the primary care side. So we have so many good people who want to deliver great care, right? I mean, this is one thing that inspires me every day is the folks I get to work with. How do we incentivize them? How do we enable them to do that work that they really want to do? And a lot of folks that I've talked to, when you think about having a meaningful, not getting burned out, right? How do you keep your workforce also satisfied with what they're doing and keep them in the game? And if you can actually have a meaningful longitudinal relationship with patients and see that you're making a difference in their lives, I think that's what a lot of clinicians want to do. But to do that, they have to be able to make a living. And so I will come back to, and my colleagues like at the Texas Academy of Family Physicians, for example, they've proposed this idea of let's kind of change how we pay for primary care entirely. Let's make it a per member per month where you're really managing a population based on quality. So you have to have quality metrics. You're also looking at cost of care, right? Because we're trying to have a cost efficient system. But I think if you give people the right incentives, and this is not easy to do in healthcare. I mean, CMS is trying to do it. All kinds of people are trying to get there. So it's not simple, but we have such a talented workforce that wants to provide care. If they have the incentives to do that and are getting paid in a way that rewards them for doing that, I just think we're going to have better access to primary care in the state and the country, which we desperately need.
And actually related to that, do you feel like in order to change that policy, is do we need more education? Is it educating the primary care team? Is it educating policymakers? Is it everybody? You know, what is really going to help move the needle, I guess, on that policy?
So, I mean, I think yes to education. And I think people generally understand the importance of primary care. But when you get into the weeds of how all this stuff gets financed, right? Whether it's Medicare or Medicaid or the Affordable Care Act or commercial insurance, you know, pretty quickly you get into my weeds that maybe a lot of people are like, okay, Lisa, you know, don't necessarily want to go that deep, but yeah, it matters. So I do think looking at what your levers are. So we have some state policy levers, right? That definitely the state can make a difference in helping to set policy that drives this. Some of this is also at the federal level, and some of this, frankly, is also employers and commercial insurance, right? So I do think it's looking at where do you have levers that you can educate folks that, hey, why don't we have enough primary care doctors in Texas? You know, why is that shortage so much greater than it is for specialists? When we know this is such an impactful thing for health to have a workforce that is able to give as many Texans as possible access to good primary care. So yes, I mean, there is a retraining of the workforce too, right? And as we think about value-based models and team-based models, that doesn't just happen overnight. And sometimes some support is needed, financial and technical assistance to get practices to be able to change, right? To deliver care a little bit differently. And that work is happening. I just want it to happen faster.
Thank you so much, Lisa, for joining us today. That was very, very informative. And as always, our audience will be able to reach out to Lisa if you want to ask her more questions, connect with her on any of the work that she talked about today. If you have any questions for us, please go ahead and send us an email if you have recommendations for more guests, especially as we get into the 2025 year. That would be amazing. We would love to hear your recommendations, or if you yourself want to be interviewed. And that was today's Texas Primary Care Consortium's Monthly Monday. Thank you so much.